Welcome back for the conclusion of The Silent Killers, Heart Disease Secrets You Need to Know. In the first video, I shared with you why conditions like high blood pressure, high cholesterol, and diabetes are called silent killers, and the subtle clues that are warning signs for more serious conditions. In this video, I will share with you some actionable steps to protect you and your loved ones, a very personal story of my patient Joan, and we'll wrap up with an inspiring message to prioritize your heart health. So grab your notebook or just sit back and let's jump right in. Let's talk about prevention. These silent killers thrive on unhealthy habits, but the good news is small changes can make a big difference. Know your numbers. Get your blood pressure, cholesterol, and blood sugar checked regularly. Knowledge is your first line of defense. A blood pressure reading healthy is less than 120/80. Anything consistently above that could mean trouble. Keep your LDL or bad cholesterol below 100 milligrams per deciliter and aim for a higher HDL, which is above 50. Your fasting blood sugar should be less than 100. Higher levels could indicate prediabetes or diabetes. Knowing these numbers and monitoring them regularly is one of the most powerful steps you can take to protect your heart. Focus on whole grains, fruits, vegetables, lean proteins, and healthy fats. Reduce salt and processed foods. Less than 2 grams of salt per day. Read your food labels. Anything that appears to be healthy may not be the best choice for you. Make informed choices. Do the work and research. We have knowledge right at our fingertips, so there's no excuse not to use it. You can always ask for assistance by contacting a registered dietitian who is trained to create a dietary plan just for you. Social media does not take the place of your healthcare provider, your licensed therapist, or your licensed registered dietitian. So make time for actionable steps to see positive results. Just 30 minutes of walking a day can lower your risk of heart disease up to 30%. Smoking, this one is non-negotiable. Smoking damages your arteries and increases your risk of heart disease exponentially. Managing stress. Chronic stress can raise your blood pressure and harm your heart over time. Try mindfulness, yoga, or just a good laugh. All of these things can be very helpful to prevent heart disease. I've seen firsthand how these silent killers impact lives. But I've also seen how knowledge and action can turn things around. One of my patients, Joan, a 55-year-old lady, came in after ignoring high blood pressure for years. By the time she saw me, she had already experienced a mild stroke. Let's listen to Joan's story in her own words.
I have always been the go-to person in my family, the strong one who is always taking care of everybody else. The last thing I remembered before I had a stroke was that my head was pounding and I was driving at the time. The next time I woke up, I couldn't even say a simple word and I had no feeling on the left side of my body. So much of my life flashed before me. My doctor and my children pleaded with me to take my medicine every day, but I didn't listen. Laying on my back at that hospital with people dressing me, cleaning me, and changing my diaper motivated me to do everything I can to gain some quality of my life back. I still face some dark days, but I'm alive by God's grace and a living testimony. I will always be grateful for Dr. Lee and the hospital staff for everything they have done to help me. Please don't take health for granted.
Even though her recovery was difficult, Joan did not give up or give into her condition. She was able to regain most of her upper body and lower body strength. She changed her diet. She continued outpatient physical therapy, occupational therapy, and speech therapy every day. And within a year, she regained her health. Now she's thriving because she chose to act. I know all this can feel overwhelming, but remember, you have more control than you think. Heart disease isn't inevitable, and with the right knowledge and habits, you can beat the odds. Start small, maybe schedule that checkup you've been putting off, or swap out one unhealthy snack for something nutritious. These little action steps can lead to a healthier, longer life. Make these small steps routine, not only for you, but for everyone in your household. That way, everyone is accountable together. You all win, and your children can continue this legacy through their adulthood and with their own children. Remember, health is wealth. Please share this video with someone who needs to hear this. Hit the thumbs up button to like this video and subscribe to The Good Doctor's Perspective for more insights on how to take control of your health. Let's make heart health a priority together. Until next time, stay informed, stay empowered, and take care of your heart.